This is a demonstration of how to provide catheter care, also how to provide proper placement of a catheter, and how to drain the down drain, and then also how to read urinary output. It is very important that you take good care of patients that have indwelling catheters, because those patients are at higher risk for UTIs. And you also need to be very careful when transferring those patients and when repositioning them in bed. If you have a patient that uses a catheter 24/7, you want to change the indwelling down drain catheter in the morning into a leg drain, and at night when the patient goes to bed, you want to put it back on the down drain. This will help with urinary outflow, and it will help with the whole health of the patient when they have catheters. I will come to see my patient now. For this procedure, I will need 2 towels, 1 incontinence pad, 1 bath blanket for privacy. I'll need a basin with warm water, and I need a leg strap to hold the catheter in place. I will need a graduate so I can drain the urine inside, and I'll need gloves, and then I'll need paper and pen so I can document my urinary output. You will also need some alcohol wipes. It's very important that you drain the down drain catheter at least once a shift, and that you record the proper urinary output. Always record in cc's or millimeters. Remember that 1 ounce equals 30 cc's or 30 millimeters. So every time that you drain the catheter, that's how you should document. I'll perform my beginning procedures right now. I will make sure I have my equipment. I'll wash my hands. I will come to the patient's room, knock at the door, and walk in, introduce myself. Then I'll identify my patient. I will ask the visitors to leave, provide privacy. I will explain my patient, the procedure that I'm doing, and then answer any questions that my patient may have, and raise the bed to a proper working height. Okay, so I'm just going to go in my patient's room. I'm going to walk in. Hi, Mr. Jones. I'm Marta. I'll be your nurse today, and I just need to provide catheter care on you. I will identify, make sure I have the right patient, which I do. I'm going to raise the bed. It's important that you provide as much privacy as possible for your patient. However, just for the purpose of this procedure, I will uncover the patient so you can see exactly what I'm doing. I'm going to lower the bed here. And I will apply the bath blanket. I'm going to put my gloves on. I'm going to uncover my patient to his knees so I can provide catheter care. I'm going to place a bath blanket underneath my patient so I can keep the bed clean. And then I will place the basin with water. Now, it's important that you hold on to the catheter right at the meatus. So when you clean, you won't pull the catheter out of the patient. I'm going to get my towel, my washcloth wet, and I will clean from the meatus out at least 4 inches. I'm going to change the side of the cloth. Clean again. And you repeat that process as many times as it is necessary. You get a dry cloth and you will pat dry. You will also watch the area, the peri area, and see if the patient needs any other sort of peri care. Okay, now that my patient is done with this procedure, I'm going to remove my incontinence pad and place it in a dirty linen. And I'm going to bring my patient's legs down, and now I will place the catheter on the proper position. I'm going to place the leg strap around the patient. Make sure that this is in the inner thigh. Make sure it's secure. It's important that there is enough of the catheter outside so it doesn't pull if the patient moves, and that the leg has the strap on. The catheter should be attached to the inner side of the leg. Also, it should be over the thigh, and it should drain in a descending order, and it should be below the level of the bladder. It should be attached to the stable foundation on the bed, which means that this is a part of the bed that does not move, and that it's not touching the floor. So all those things you need to be careful when you are verifying for catheter placement. Now that I know the placement of my catheter, I'm going to cover my patient back, and I'm going to drain the down drain. I'm going to place a paper towel on the floor, place my graduate underneath the catheter. I also need an alcohol wipe. So now I'm going to pull this little pouch out and then open it up. You need to make sure that you drain the catheter entirely. You need to seal it closed. Now you're going to clean with an alcohol wipe. to place the graduate with the urine contents on a flat surface, you want to make sure that you never place any bodily wastes on a overbed surface. It has to be on a dirty surface, and it has to be flat. Before you record any urinary output, you want to make sure that you check the urine for the color, odors, and any sediments and clarity, and make sure that there isn't anything abnormal that you need to report to the nurses. Now, in order to read accurately, I need to read at eye level. So when you're reading the graduate, you want to make sure that you read in cc's. And as I read up here, I can see that the urinary output was 300 cc's. And just to explain how this works well, you have to understand that each one of those lines represents 25 cc's. So if you go from the bottom, you have 50, 75, 100, 125, 150, and so forth. So the urinary output for this patient was 300 cc's. So my next step is to record to make sure that I am accurate. So dispose of the contents in a toilet. You're going to wash the graduate, disinfect, and put it away according to facility protocol. For my ending procedures, I'm going to make sure that I cover my patient back. Make sure my patient is comfortable. I'll make sure to leave the call light, water, and phone with my patient, and then to do a safety check and open the curtains. Then I will gather my equipment and wash my hands. I'll let the visitors know that they can come back, and then I will also record and document my procedure.